Instead of cell or animal data, they used AI to analyze human data points to provide researchers with more accurate representations of effective treatments in humans. This avoided the risk of drug failure when translating animal studies to human trials. If you've experimented with ChatGPT, you've experienced AI's writing capabilities firsthand, a co-author on multiple papers. However, it's not without its limitations, including the hard. Other software, such as Consensus, can be used to guide your initial literature review and provide summaries for papers that answer your research question. Don't expect these tools to take over your academic writing just yet. However, they can catch grammatical errors, brainstorm ideas, and collect and synthesize data. We dug into the possibilities and drawbacks of using AI writing tools in another video on the future of medical school healthcare. For example, BotMD is a company with an AI service that assists patients with clinical issues like finding physicians on call, scheduling appointments, or answering prescription-related questions such as the availability of certain medications or their alternatives. Allowing AI to take over these tasks can free administrative staff to focus on other obligations, minimize insurance, and optimize billing for physicians, since billing is reliant on prevent physician burnout, a significant problem that leads to psychological distress for doctors and worse outcomes for patients. Lastly, AI is quickly being integrated into medical education at all levels of training. For example, Oscar, an Australian medical education company, allows medical students to practice their history-taking skills on AI patients. Using this tool, students can learn to ask the proper questions and consider various diagnoses for any specific presentation.
UC Davis Health this year as our first AI advisor. Dr. Lubarsky and Dennis, welcome. Thanks for being with us.
Thank you. It's a pleasure.
Yep.
I sort of want this to be a free-flowing conversation. I know both of you have a lot of really interesting thoughts on AI, and I want to start by saying that if you ask the average person what comes to mind when you say AI in healthcare, they're probably thinking of analyzing patient data, helping to make diagnoses, but there is so much more than that. How is UC Davis Health approaching AI's role in patient care and health?
Well, I think the first and most important thing to say, Pamela, is that doctors and nurses are in charge. Doctors and nurses will always be in charge of not only the decision making, but in being the partner to the patient in the decision making. And AI is our doctor and your nurse more tools to make better decisions for the patient.
Yeah, there are a lot of areas where AI can make a big difference, of course. So the patient-provider relationship, but also on the administrative side, operations, business side, how health systems, large academic medical centers think about workforce transformation, creating better recruiting, retention, career paths for people in all the different roles that are involved in patient care, administration, everything else. So I think they're going to need less care. And when they do need care, they will have better guidance, I think, on the kind of care that they might need, how to connect with the right professionals, and how to stay on course, with the right recommendations, and why it's important to listen to medical professionals.
When it comes to AI in healthcare and its implications, what else are regulators keeping a close eye on?
Yeah, the regulatory environment's very interesting. That conversation has rapidly accelerated, especially in the last few months. There have been a lot of discussions and things over the last few years, but over the last few months we've seen some really interesting things happening. Of course, we had the AI executive order coming out of the White House towards the end of October that builds on some previous executive actions, but really takes it further now, looking at more specific requirements for the private sector, not just directing government to ensure AI safety and government AI systems and government use, but how our markets in the private sector can help ensure consumer safety and patient safety with the use of AI technology. So things like watermarking AI-generated content, for example, or other forms of disclosure so that folks know that they're speaking to an AI chatbot rather than a chatbot pretending to be a human to try to create a more human experience or something like that. I think it's very important that we always help make people aware of what exactly they're interacting with and in what ways. And there are a lot of implications from these regulations that are coming out, including the AI Act in the EU, that's still kind of being discussed and advanced, that health systems, academic medical centers are really going to have to, get more thoughtful about their adoption of AI and how we think about governing AI. Another thing that's coming out in the regulatory environment, at least for the federal government, is that federal agencies are going to be required to have AI governance boards to ensure safety, efficacy, ethics of AI systems, and also the requirement to have chief AI officers or advisors, somebody leading that function. I think currently in academic medical centers, health systems, kind of large enterprises broadly.
And so that was sort of, what I was thinking in terms of who is ultimately responsible when AI is used to support decision making and patient care. You've made it clear it's the people.
It's the people.
But what is the relationship between artificial intelligence and human intelligence in terms of how they reinforce one another?
So that's a great question. A lot of people think that AI exists. It's a magic thing, right? It's not a magic thing. It's ability as a computer.
It's a tool.
It's a tool. Just, we used to, right, not be able to copy and paste from Microsoft Word to PowerPoint, right?
Yeah.
I mean, it's about integrating data and information, and then, but someone still has to make up the PowerPoint presentation, but it's easier now, right? It's the same thing. So we're working with a company that does remote patient monitoring. And right now, it has 8 different vital signs that it collects every minute of the day. That's 1,440 minutes. 8 vital signs each minute, okay? That's 11,500 or so data points per patient, right? And it can, in the beginning, applying AI, which looks at
Technologies, we really need to err on the side of caution.
Right, and I think is way down the road. It's 5 years, 10 years before we'll have the right level of insight into data to really let AI really suggest treatment suggestions. But all the rest of it's really worked out and we're just not employing it. Vision computing, ambient computing, listening, generative AI, which just says, you've just talked for 17 minutes here, let me summarize what you said, and I can do that in 4 sentences because you've really been talking a lot and not saying a lot. But right, and so all of that already exists, and summarizing, not always perfectly, what has been written by others, like Amazon on their review sessions, right? All that stuff exists. And pattern recognition, that's great, and facial recognition. And right? We can do all of that and not cede 1 ounce of responsibility or decision making to computers. We can make doctors more efficient. And I'll give you an example. Breast mammograms required to do a day's worth of readings in half. You may say, oh, someone's going to lose their job. And I'm like, no, actually, only half the women in America who should have their breasts done for mammograms get them read. Imagine if we, without adding 1 penny to the labor workforce, we can now get to 100% of women and have their breast mammograms read by professionals, subspecialty
Expanding
trained.
access to care.
Yeah, doing more on behalf of the patient.
We will never, ever be able to catch up with the demand right now because of the aging of the population, the expansion of the possibilities, and hopefully a continuing journey towards wellness for a much longer period of time in the topic. And I will use a couple concrete examples. We know for a fact that when black and brown children come to the emergency room, they don't get as much pain med as a white child. I mean, you can't find a doctor or nurse who's saying, I'm purposefully not giving, someone who looks different less medicine.
Right.
But that's what you do when you so how does AI help?
Right. So
that?
when you look at the data, there's implicit bias.
Correct. So if you just said to an AI-driven engine, how much pain medicine should I, ceding responsibility, give to this child? If it just looked at all the medical records in the United States and said, well, on average, this child would need 3 milligrams of morphine and this white child would need 4 milligrams of morphine.
Right.
Because that's all that exists in the database.
Right, so it's like just as little as before.
Yes, the way out of that, it also turns out it's often not the color of someone's skin, it's their familiarity with English. That if you don't speak English as a first language, you're unable to communicate as well the desires for additional treatment or a different expectation. And so that leads to undertreatment
just as a very quick bit of background, we used to have no encryption when it came to data. Then we got encryption at rest while data's sitting there, okay, and that was great. And then we got encryption in transit while we're transferring it place to place. For example, if we're doing a telehealth consultation, all that data is encrypted now, right, as it should be. And now we've got encryption in modeling, or what people are referring to as confidential computing, or the application of these privacy-preserving technologies. And so as healthcare executives, administrators, I think we all, and so we very much view ourselves as stewards of this data. And we're all, patient data being exposed somehow, but at the same time, we know that this data can be very valuable in advancing medical science and research and innovation. And so we're stuck with this dilemma of how do we make this data accessible, but without sacrificing safety and privacy. Privacy-preserving technologies can help us significantly advance in that regard. One more thing I'll mention that I think will also be helpful is over the last couple of years, there's been a special task force intended to help make AI research and more data sets accessible, including in healthcare, to help advance more equitable AI models and applications. And so that task force put out some recommendations in January of this year that have since actually been approved through legislative action in Congress. So we're getting a national AI research resource that is intended to help actually democratize AI research and model building by bringing together more public and private data sets that are relevant in an environment where they can be used, and also providing access to computing resources that can be very expensive sometimes, especially for smaller institutions or individual researchers, things that are usually more available to larger institutions. But this National AI Research Resource is really trying to create an environment that's going to allow more research and innovation, including in medicine more broadly, all across all types of researchers and institutions.
Right. I think that's really critically important. Again, the guidance and thinking the large thoughts. Make the small stuff possible to do in an ethical manner. And one of the things that people don't realize about AI is that its application to both populations and real-time care of individual patients, that we can be analyzing every single thing we're doing, every dose we're giving, and we talked about differences in pain medicine application. We spend a lot of time hammering away at our care providers and administrators about eliminating all the implicit biases. We're in California,
Yeah.
We're a little more aggressive about that.
Yeah.
But there are implicit biases that really govern a lot of attitudes and actions across the United States, healthcare being no exception. And so if you had an AI engine running in the background and saying for every physician, for every type of patient, for every nurse, right, were they delivering the right type of care, and not to harm the provider, but to educate the provider.
Yeah.
Like and get things back on track.
It's great for issue spotting.
Issue spotting. That's yes.
One last question. I'll ask it of you, Dr. Lubarsky. This is sort of our final word. What is one takeaway, if there's just one takeaway from this conversation that you want our patients to know, and one takeaway that you want our employees to know, what would those be?
AI is augmented intelligence. It's for every employee, every nurse, every doctor to use on behalf of their patients for whom they are solely responsible, and we will never cede control of our care for human beings to computers.
Thank you. Dr. Lubarsky, CEO of UC Davis Health, Dennis Chornenky, our first Chief AI Advisor at UC Davis Health. This has been a discussion on artificial intelligence, or AI, in healthcare. Find more interviews on our UC Davis Health YouTube channel and more information at our website,